Health headlines. Stroke is a leading cause of death and disability, and women face added risks.
This morning we are talking about why they happen and what can be done to prevent them. Joining us now live, Dr. Safa Hakim El-Nazar, a neurologist at Yale Medicine who specializes in stroke care. Doctor, thank you so much for being with us. And let me begin with this. What are the risk factors for stroke that both men and women share?
Thank you for having me. Conditions that affect heart and brain health are not limited to, but include the most common: high blood pressure, high cholesterol, diabetes, sleep apnea, smoking, as well as atrial fibrillation. We're seeing a rise of stroke in the young, so it's important to be on the lookout for these conditions, even in young individuals.
Absolutely. And I think a lot of people their mind when they think of strokes, they associate them with men. But the research actually shows that women are at an increased risk for stroke these days. Why do you think that is?
So women are at increased risk of stroke through various stages of their life due to hormonal changes. For example, in some cases, migraine with oral contraceptive use, especially in women who smoke or have other stroke risk factors, can put them at risk of stroke. During pregnancy, there's a set of conditions that put women at risk of stroke, like gestational hypertension, preeclampsia, preterm birth, or fetal growth restriction. At menopause, the drop of natural estrogen put women at risk of stroke, but it's important to note that hormonal replacement therapy also could put women at risk for stroke.
Doctor, what can women do kind of to get ahead of the game, to work proactively, to lower their risk of suffering a stroke?
Good thing is most strokes are prevented. It's important to know your numbers. So make sure your cholesterol, blood pressure, sugars are well controlled. That could be done by visiting a primary care physician regularly, leading an active lifestyle physically and socially, healthy eating. Mediterranean diet is rich in plant-based food as well as healthy fats, as well as staying away from smoke and recreational drug use. Staying engaged in the local events. There's an event on Saturday for stroke prevention in New Haven that could be a good community engagement as well.
Wonderful. And before we let you go here, let's quickly talk about the signs of stroke. What should we be keeping in mind?
Absolutely. BFAST is an acronym I tell all my patients to keep on their fridge. Sudden onset balance, loss of balance, eyesight, facial droop, arm weakness, one-sided arm weakness, speech dysfunction, not able to talk right. And the T stands for thunderclap headache that comes all of a sudden, worst headache of life. And time stands for don't waste time, reach out to 911 right away.
All right, doctor, some great tips, great information. We appreciate you.
Thank you.
Absolutely. Thank you so much for having me. Bye.